Okay, so today we're going to be talking about MCV. MCV is caused by a pox virus called the Molluscum Contagiosum Virus. It is most common in children ages 1 to 10. MCV type 1 is the strain typically seen in children. However, MCV type 2 is typically a sexually transmitted disease seen in adults. MCV can be spread not only through sexual contact, but through close personal contact. It can also be spread by contaminated objects such as towels, linens, and toys. This is why MCV is so common in children. However, most cases of MCV in adults are transmitted through sexual contact. MCV can also be spread to other parts of the body by scratching a lesion and then touching another part of the body, or through shaving. Symptoms include small waxy bumps or lesions around the genitals or thighs. However, these bumps may appear or be spread to anywhere on the body. They may or may not be itchy as well. However, it is important not to scratch them in order to reduce the risk of spreading. So how can we prevent MCV from spreading? Well, the best way to prevent the spread of MCV is to avoid close contact with infected people. This includes using the same towels and linens. If you have MCV, you should wear clothing or bandages to cover your lesions. Avoiding sexual contact is also important. While condoms can decrease the risk of transmission, they do not cover all areas of the skin that may be infected. It is best to just avoid sex altogether until the virus is gone. While MCV can go away on its own, it can take up to 2 years. In order to prevent the spread of MCV, it is a good idea to see a doctor for treatment. MCV can be treated by your local healthcare provider. They can provide you with a prescription for a topical treatment that can be applied at home. Your doctor can also remove the growths in office. This would require the doctor to freeze them off, apply a chemical, or use an electric current in order to remove them. Other things to consider are those with compromised immune systems, such as those undergoing chemotherapy or those with HIV, are especially susceptible to this virus, and they may develop complications. People with MCV should be especially cautious of transmission in the eye area because they could develop conjunctivitis or keratitis. Here are some statistics on MCV.